I'm Dr. Vikki Petersen. I'm here today with Dr. Rupa Chakravarti, and she is our Doctor of Physical Therapy here at Root Cause. And you have been a Doctor of Physical Therapy for how long?
Well, I've been a physical therapist for almost 27 years.
27 years.
Wow, yeah, that's a long time, right?
And now your extra degree, as I call it,
Yes.
OCS, Orthopedic Certified Specialist.
Yeah.
And that's been how many years?
That's been approximately, I would say, 9 years.
Wow, that
Yeah.
went fast.
Yeah.
Okay.
8 to 9 years, I think.
Yeah. And is it still true that there's not very many doctors
Yes,
that
there are
have
not too
that
many
degree?
orthopedic specialists around.
Okay.
I mean, the field of physical therapy has different specializations, and orthopedics is one of them, and it's a very, very difficult exam.
Yes, I remember.
It requires a lot of study.
She studied for an entire year.
Yes,
that's all.
you have to study for an entire year, and the exam is just given once a year.
Oh boy, yeah.
And you need to clear it.
And you passed the first time.
And I passed the first time.
And the passing rate was?
Very, very low.
Not much. Anyway, so what I wanted to talk about today is, I know I never received physical therapy. As a doctor of chiropractic, I was trained in some physical therapy, but I never received it until you joined our team.
Sure.
But what would you say people think physical therapy is?
Well, the general idea of physical therapy most people think about is post-injuries, right?
Mm-hmm.
I injured my shoulder, I had a fracture of my knee, or I had a surgical, procedure done. And most of the doctors refer for physical therapy post-op.
Right.
And of course, that's the common knowledge.
Yeah.
And that's the common belief.
So someone had knee surgery or shoulder surgery, as you said, and then their orthopedist does the surgery and then says, go get some physical therapy.
Right.
Okay. Now, how is what you do, because it's very different, I know that, but how would you describe the difference between sort of that typical physical therapy that people get and think of versus what you do?
So early on in my career, I realized one thing is prevention. If I can help people prevent these pathologies and injuries in the first place, why not? I mean, physical therapy is so broad, and there's so many things which need to be done in regards to exercises, lifestyle, fitness. Why not get into doing more of a preventative role versus now trying to salvage the body post-op or post-pathology? You know what I mean?
Right.
So,
when a lot of damage has occurred.
Right. I mean, that was one of the first things which I realized early on in my career is, these things could have been prevented. If the knee was in this arthritic condition, how did it get to that point?
Right. So all the misalignment and the wearing down of the joint because of the misalignment.
Exactly.
Imbalanced muscles. Okay. Yeah, no, absolutely. And then I know, because I see all the new patients that come in here and I do all the histories, and I hear over and over again, I've tried physical therapy, it didn't work.
Right.
Why do you think that's such a common reaction?
I think one of the key components with the field of physical therapy and how it has grown over the years, and believe me, I've seen so many transitions over my 27 years, is more and more visits are, I think I should just say this.
That's okay.
Yeah.
Let me ask the question again. So, so why do you feel that people don't see the benefit of physical therapy? They say, I've tried physical therapy, they're not too excited about it.
Right. I mean, first and foremost, physical therapy is not fun. Obviously, there's a lot of exercises and people hate doing exercises.
It's like the functional medicine side where we make you change your diet. Yeah?
Right,
you got to work for it, as I like to say. Yeah.
Exactly. Nobody likes exercising unless and until you're like a big gym rat.
Right.
So, and as physical therapists, we are definitely asking them to do more and more exercises, which people don't like doing. So it's not fun to begin with. It's conservative management. That means you have to come for a very number of sessions to be able to get certain work done. And I think people get complacent with it.
Yeah,
right?
Yeah, they get a little
lazy. Scheduling, family, life gets in the way of them feeling 100%. So even if they achieve certain results or certain goals in a set number of visits, they think, oh yeah, this is fine. I can do this on my own. I don't need to go to a PT.
But the thing I hear from our patients is, especially if they've been to physical therapy before, they'll comment, this is so different from what I ever had before.
Right.
So what is that difference?
So again, through a lot of trial and error over the years in my practice, what I've come to realize is I have developed my own little ideology with physical
Sure.
therapy and
Yeah.
what needs to be done and what doesn't need to be done. Unfortunately, a lot of physical therapists are shying from a lot of hands-on and manual work, possibly for various reasons. One is maybe they're not trained that well in those techniques.
So the hands-on
And the
work.
hands-on work,
'Cause
the
I know-
manual therapy
yeah.
work is definitely slowly going downhill. You need specialized training for it. More and more PTs are not willing to invest in that kind of training. So there are very few skilled providers in that.
So it's a skill set that you
It's
have.
a skill set
Okay.
you have to build over the years. It's not like okay, I come out of school and I start doing manual work, I'm an expert on it. It's not like that.
Right.
So you need some experience
you're-
with it.
Yeah, one thing, as having been a recipient, I was an ex-figure skater, so I come with a whole slew of a lot of long-term injuries, but your ability to not just do orthopedic and neurological testing, but then when you get in there and you're feeling,
Right.
you can tell exactly what's going on. So I know that's very unique. I know hands-on is something very few physical therapists do.
Right,
So you're saying
right.
it's that they haven't invested the time in it. I know it's also very labor intensive.
It is very labor intensive. You're
Yeah.
absolutely right. It is indeed very labor intensive. You need to have very good understanding of the human body anatomy, muscle structure. You have to be able to discern where the problem lies through palpation.
Right.
And that's a big skill set.
Yeah, so the touching and the feeling and
Yes,
figuring it out.
exactly. I think many physical therapists are not necessarily skilled in that. And there is a big emphasis and there's a big focus in schools to kind of stay away from that, if I might say. And a variety of reasons. It could be they want further certifications in it, so either way. So many times people do go to physical therapists, and I do hear this very often. It's very cookie cutter.
That's what I hear.
Yeah, it's very
like
cookie cutter. They're given some exercises. They're
Yeah.
given modalities like ultrasound and stim and ice, and they're sent on their merry way.
Right.
So I feel that's not ideally what I would want to do.
And it's almost the same thing, like what makes us different in functional medicine is that it is that diagnosis and it's that deeper
Sure.
understanding of how everything's interrelated instead of, I've come in with knee pain and I actually have one hip that works differently than another hip and you now know that about me and it's like, do this, don't do that. And it's that depth of understanding, I feel, allows you to get the great results.
Right.
And I think it's unfortunate that, sometimes I'm just saying, just experience one session and you'll see the difference. And people
Right.
do. It's sort of, cajoling them, encouraging them to experience it so they can see the difference. Because
Absolutely.
if they've just had hot pack or cold pack and some electrical stim and handed some exercises,
That's not enough.
It's so not enough.
It's just not enough.
It's
yeah.
far from being enough, yeah. And then I know one of also the big differences here on whether functional medicine and physical medicine at root cause is we're all about correction versus relief. And I know being a doctor of chiropractic in addition to functional medicine, I know that that's not taught in chiropractic school. Would you say it's also not taught in physical therapy school? It's more relief oriented?
Yes, it is definitely more relief oriented. It has become over the years. I shouldn't say that all the standards of care and everything, they do. There has been more of a drive, I think, with one of the cons of evidence-based practice, which I must say, is they don't really want to understand too much about experience. I think it's more about, okay, as per research, this is what works.
So in other words, to get to a level of better functioning,
Right.
it should take 10 visits or something like
Exactly,
that. And that's the
exactly.
kind of, when you get prescription, when a patient says, had that surgery 3 times a week for 4 weeks, and then you should be fine. And we know that that's not enough for correction. It's just enough to get relief, but
Right.
then the person's still unstable,
The
right?
person is still unstable. For example, a classic thing is ankle injuries and ankle surgeries, right? We're given a certain amount of visits, but we know for a fact that the ankle takes a long time to heal. Stability, balance takes a long time to get back. And these patients are forever prone to having more ankle sprains and more problems later on over the years.
And it's just never back to normal.
It's never back to normal. But if you don't work hard in getting that normalcy back, you're obviously, you're obviously going to have this patient coming back to you again and again.
Right. Or give up and just say, I have a bad ankle.
I have a bad ankle.
Right. Which we hear a lot. Yeah.
I mean, you're not definitely rehabbing them to their optimum function, which, of course, is, again, totally built on that person.
Right. And then, of course, the first stage of relief is they feel better.
Right.
So what are the tools you use to demonstrate that change, that objective change all the way through to correction, so the person knows they've achieved correction? What kind of things do you do?
My programs are very objective, measurement based, right? I do evaluations every 5 weeks with anybody who walks into the clinic. And these evaluations have to have certain measurement goals. I'm constantly comparing it to my first evaluation, to my first reevaluation, constantly comparing it and making sure that it's not just the patient who's telling me they're feeling good or they're feeling bad. I need to see clinically and objectively how they're feeling too.
Right.
So it's highly objective, and I measure all these tests and ranges and muscles and everything on a very, very regular basis.
And then the patient can feel it too, and
absolutely. The patient can see those results for themselves, and they get validated with it.
No, absolutely.
Right.
And I know you also work with the nervous system, which a lot of times that wouldn't make that connection. We have an interesting case right now, a gentleman who, our ex-Marine, as we're referring to him, no names. But what's unusual that you're doing with him? Because I think it's pretty fascinating, and he's feeling better already, and it's only been a few days.
Right. So this gentleman was diagnosed with hiatal hernia, right? It's such a broad diagnosis, of course. And he's had a bunch of abdominal symptoms like bloating, acid reflux, panic attacks, and shortness of breath. He's unable to even take like a deep breath, and he's been non-functioning is the right word to use.
Yeah, he's been off work since January.
Since January of this year.
We're taping this in November, so almost a full year.
Almost a full year. And he's desperate because he has to get back to work. And so during the evaluation, one of the most common things which I, of course, check for is breathing circumference, and I palpate for the position of the diaphragm, the abdominal area, and the thoracics, and the lumbar, the back, and do all the testings. But his breathing circumference was really poor.
So that's sort of how much he can expand, how much air he can get in.
Through his ribcage.
And he knows he's short of breath, but you found it to be sort of barely moving.
Barely moving. Yeah. And this gentleman
this is a big guy who works out.
Yes, exactly. And this guy was like, this is exactly what I have been telling all my doctors all this time, but nobody has ever measured it.
Right.
And nobody has ever commented on it. And another crucial thing was I found a close correlation with his neck. He's always had a very stiff neck. Range of motion in his cervical spine was highly, highly limited. Sort of got me thinking about the vagus nerve, right?
Yeah, so that's the biggest cranial nerve in the body that goes to every organ. It's a very important nerve
because it controls our flight and fright reaction.
Right. So you can get into that high stress, anxiety, which he was there with.
He was there.
He'd been to the emergency room 10 times with panic attacks. And this is an ex-Marine. This is not like some wussy guy.
Right, exactly. So the first thing is right off the bat, after all this detailed examination, I was able to kind of understand where the problem lies. It's just not the diagnosis of hiatal hernia, but why? So just asking the question, why did he even have it in the first place, right?
And through a non-surgical approach, you're actually rebalancing his vagus nerve.
Yes.
Yeah, which is pretty fascinating.
Yes, through a lot of different kinds of craniosacral techniques or other manual therapy techniques. I have a combination. I don't just follow one rule. It's not that one thing follows all. I have different skills in my.
You have a very big tool chest, I think.
That's right. That's
a mammoth tool chest. So you have to get back to work. I know that. But my final question is, what do you love about being a physical therapist?
I think I'm extremely passionate about being a physical therapist. The thing that I can change somebody's life and get them moving and going places is what drives me.
Yeah.
I think that's that's to sum it all.
I can attest to the fact that you're very, very good at it.
Well, thank you.
Thank you for sharing some time.
Thank you.
We'll let you get back to work.
Yes.